Ukraine Center starts its operation. My name is Svetlana Shaprenko, and now we will be talking about the new strains of COVID-19, the statistics of the incident rate, and how this strain can be of threat for us. And joining us in the studio are Oleksandr Zaika, head of the Department for Infectious Disease Prevention and Immunization, Ministry of Health of Ukraine, and Oleksii Danylenko, acting Director General of the Public Health Center at the Ministry of Health of Ukraine. So, the new strains are called Stratus and Nimbus, something reminiscent us of Harry Potter. Quite interesting names. So tell us, how dangerous are they? When was the first time they were documented in Ukraine? And what are their characteristics? Thank you very much, Svetlana. Greetings, everyone. Greetings to all of the spectators and listeners. I wish everybody strong health in our challenging times. So, talking about coronavirus, we have to understand that it's not gone anywhere. It's circulated, and there are sub-variants of that Omicron strain that everyone is aware of, that everyone has learned the name of. So, the new strains are appearing, and we have a potential to identify them, and it's really good. And you were right to mention that this subvariant Nimbus, there are already 2 documented cases, the first in Odessa region and another in Vinnytsia region. So when it comes to the status, we have about 80 cases in general. So it's one of the subvariants of Omicron that we all know. But fortunately, this existing strain doesn't entail any difficult consequences, but let's not forget about them either, specifically when it comes to vaccination. So those strains are circulating, but if we check the number of cases that we have for the time being and the number of those who report to the hospitals and get treatment there, the incidence rate is way lower than we were having within the same period of the previous year. We forecast that there might be new cases, but at the same time the medical facilities network is capable of providing necessary amount of aid. So can you name the number of cases? Within the last week, for all I know, it was about 1,000 cases, but it's again, that's the number which is smaller than during the previous period of the last year. Like last year we had 2, 3, or 5,000 cases per week. Now we're not talking about like any significant outburst, but it's just the gradual growth of the incidence rate. That's the first important thing to mention. And another, when it comes to groups of risk, we know that people age 60 plus, the medical workers, those who work with other people, those who have additional or accompanying diseases of the cardiovascular system, they are more vulnerable to coronavirus, and the complications may entail complications of coronavirus may entail complications of those accompanying diseases. So first we advise to check the vaccination status and to get vaccinated if you're past your due date of vaccination. The National Vaccination Group advises to get vaccinated on annual basis or maybe even twice per year for those critical groups. It doesn't mean that all other Ukrainians are not supposed to get vaccinated. Obviously, we advise them to get vaccinated and get protected too, but again, the emphasis is on those risk categories. The people aged 60 plus, children who have some immunodeficiency conditions, or the medical workers. This is when it comes to risk groups. And the annual COVID campaign, we had certain success in the COVID campaign because more than 50% of the adult population at least got 1 dose, having protected themselves, but they didn't get booster doses, and now it's right about time to get protected. So another matter I would like to discuss is the availability of vaccines. And here I would like to mention that for Ukrainians, for all of the Ukrainians, including the risk categories, the COVID vaccine is free of charge. It's available in necessary amounts in all of the regions. It's available on both national and regional level at the bases, at the warehousing facilities of our disease control centers. That's one important thing. And another is that we continue working with the Global Vaccines Alliance, not only in the context of routine vaccination that I also need to mention, but also in the context of COVID vaccines, because the Global Alliance are the ones that continue supplying the free vaccines to Ukraine, both for children and adults. And for the children, this year there will be another vaccine available, manufactured by Pfizer, specifically for the age group 6+ months. Hopefully it will be available starting from September this year. And those children in this age group for whom the pediatrists are going to prescribe this vaccination are going to be able to get it again pursuant to the prescription of the doctor. So if you know that you are in the risk group or your children need that additional vaccination, please report to your family doctor, to the pediatrist, get your consultation and get your free guaranteed COVID vaccination. Another question about vaccination. The main wave of the vaccination campaign was happening in the years 21-22. So if a person, if like an average adult out of the risk category has taken all of the vaccines, including the boosters, is that protection sufficient for the time being? Is it still working? Well, I would put it like this. All of the available vaccines, they are of high quality, they are efficient, and they are available in necessary amounts, and they work against those strains that we've mentioned. That's the first thing. And secondly, if you're out of that risk category but you were vaccinated before, yes, those vaccinations can still protect you, but the national vaccination expert team advises to make vaccination at least once a year. That's not a mandatory vaccination, that's only advised for everybody who desires to do so, but with an emphasis on the risk categories, because the complications may be difficult. I'm not going to list them, but that's for sure that COVID may entail the complications of the accompanying diseases that you have. If people are really afraid of COVID, of the new strains, can they report to the family doctor first or directly to the vaccination center? Well, first of all, the platforms that existed before are not so available. You know, due to security conditions, the mass vaccination centers, they don't operate anymore in the regions, but definitely you have a family doctor and there are specified vaccination spots. So first report to your family doctor, check your vaccination status, because you might have been past your due hepatitis vaccination or else. So again, your route lies through your family doctor. And next, thank you, Mr. Oleksandr. Mr. Oleksii, let me ask you a little bit more about the new strains of COVID-19. How does it manifest itself? What are the symptoms? And how is it specifically dangerous?
Thank you. First of all, I would like to say that unfortunately, COVID manifests itself again. It was assigned a heightened category of risk in 2023, and it wouldn't be a COVID if we didn't have it in the summer season. Just like the previous year, we are seeing the increase in cases of this disease. And I will talk about how we provided monitoring and how we did it every weekly. And if we are talking about the 32nd week of the epidemiological season, then we are seeing 1,000 more than 1,000 cases in the first week. If we compare these numbers with the previous year, we also see the increase, and the numbers themselves were much higher, around 10,000. So as of today, the levels in comparison to the previous year levels are much lower. And the pressure on the Ministry of Health of Ukraine is also less, significantly less, and we are going to monitoring the situation. The COVID in general next week we will get the information about this 32nd week, and this information will be published, and I advise to follow our sites and the Center of the Civil Health and the Ministry of Health of Ukraine that will be providing these numbers, the situation around the COVID, and not only about these, also other results of the continuous monitoring, and this data is published there too. About new strains, as Oleksandr said, we have this stratus new strain, and it has another scientific name. Yeah, that's its name, and NB181 is the gradation. Its gradation is so we don't overcomplicate it, and it's nimbus and stratus for simplicity. And also it's a subtype of a micron that everybody is familiar with. It's characterized by more rapid spread around population. However, it does not provoke harder process of sickness and than the COVID-19 even, and sometimes we are seeing symptoms apart from the classical ones, is the broken down voice and some other characteristics that are connected to the bronchial system. However, new strains, what's characteristic of it is it's spread around the youth and the children without manifesting symptoms, and this where it's posing its main threat, because the people without symptoms could be potential carriers of potential hosts of the virus. And unknowingly spread it around the territory. What needs to be done? How we prevent? How do we do the prevention measures? We don't have any other critical recommendations apart from those that we already provided. As soon as you are having symptoms, no self-curing, straight to your family doctor. Figure out the algorithm of treatment, which is different for every case, and avoid the mass concentration of people, places of a mass concentration of people, and of course this is also vaccination. Oleksandr provided information on that matter already, so the hands hygiene, surfaces interactions, and those simple measures that help us avoid this disease. We heard that there would be a regime, a mode of obligatory mask wearing could be introduced. Is it correct? No, we haven't heard anything like this yet. However, there are general recommendations. I hope that under the condition of following those recommendations, we will not have to introduce any additional measures of safety. Oleksandr, did you want to add anything? No, I just wanted to conclude, to make a conclusion with everything that Oleksandr said. those recommendations, they are simple, but if you're using them in your everyday life, they will help prevent the infectious disease spread. COVID inherently does not have a very high rapidity of spread in incidence rate. What are we seeing this year? Well, regarding the preparation to the next epidemiological season, this kind of work is conducted every year. We are already preparing for it in terms of flu and other respiratory diseases. As of right now, we have increase in COVID cases, and I hope that we will manage to overcome it after we before we enter the next epidemiological season. And we still need to remember that vaccination is really important, especially for flu. Because it's not. I would like to remind it's efficient, it's accessible, and everyone can go and procure it and have a vaccination. Employers can do it in a centralized manner as well. Thank you. Maybe journalists have any kind of questions. Another additional question: the flu, the vaccination from the flu. What period of time is the best for vaccination against flu? Yes, I will answer this question. We recommend to vaccinate before. Immediately before the beginning of the epidemiological season. And when we already know the general information about what types, what strains of the flu will be present, also I would like to say that you can do it basically anytime during the season. And it's just we don't, we cannot really predict right now how intensively it will be manifesting, and that is why we will do according respective adjustments. And right now we don't know it, and you can vaccinate yourself anytime during the season. This is first. And the risk categories are the seniors and the people with high risk jobs like reinforcement, law enforcement, and the pregnant women. So what we recommend to these people, they need to do the vaccination as soon as the epidemiological season starts. Also, I would like to remind that the vaccination is not obligatory, and they are paid. You need to pay for them, but however, they are accessible on the market, and a provision of the vaccine is a long process, and as you may know, there are different strains of all around the globe, and when some of them are in one place, other types are in another place, and the Ministry of World Health Organization is monitoring the situation, and in accordance with it, spreads the information about which treatment and which diseases are to expect. So that's what we were talking about, the new strains, and we are preparing for the next time. Thank you for staying with us. Thank you.